Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
We hope you enjoy listening to this podcast of St. Louis on the Air, brought to you by University College at Washington University, with undergraduate and graduate programs part-time, evening, and online. University College at Washington University, offering world-class education within reach.
Millions of the 60 million Medicare beneficiaries across the nation are right here in Missouri and Illinois. All of them have or soon will have received new Medicare insurance cards. We'll be talking about why and also about an important deadline for recipients. Joining me in studio is Julie Brockhart, Public Affairs Specialist with the Regional Office for the Centers for Medicare and Medicaid Services in Kansas City. Julie, welcome.
Thank you for having me.
Well, tell us about these new cards.
Well, so this has been a long time coming. Actually, the old cards had Social Security numbers on them since the inception of the program, more than 50 years ago. And so the new cards will have a uniquely generated number, not identifying you in any way. So it's preventing identity theft, fraud, and some healthcare fraud as well. Beneficiaries have been asking for it for quite some time. It did take an act of legislation to make this change, and it finally happened. And so we've been rolling out the new cards over the since last spring, and Missouri is finally getting their cards. Now, Illinois already got their cards back in the summer, and those should be complete, but they just started mailing in Missouri in October.
Well, Medicare is a little late to the party on this subject, and I see why if it had to go through the legislature. But Missouri's driver's licenses stopped the Social Security numbers some time ago.
Yes, and I live in Kansas, and actually the same thing, and for the same reasons. We don't want our Social Security numbers out there. And it did take a while to make changes to all the systems who interact with Medicare as well, like Social Security, the Advantage plans and such, yes.
I can't imagine how complex that has to be. We're talking about 60 million beneficiaries. That's a lot of people.
Yes, and actually we're generating more than that in numbers because we keep track of the deceased Medicare beneficiaries as well. So it was over 150 million cards that had to change numbers.
How big a problem was the problem of identity theft and fraud prior to this change?
It was an issue. People calling up and asking seniors for any reason to give them their Medicare card number, to say if you don't do this, your benefits are going to stop. We want to send you some information asking for that number. And so personal identity theft and healthcare fraud was an issue, and so it's finally changing.
If people here haven't received their cards by you give me a certain date, what should they do?
Okay, so you should be patient. We'll tell you that because it does take, for 1.2 million in Missouri alone, it takes a month to mail those out. They're doing it by alphabetical by your last name, and so we're into the second week. Beginning the third week. And so wait until at least the end of November. Don't start calling and asking where your card is. You may not get it at the same time your neighbor. But if you haven't gotten it by the end of November, you're going to want to call 1-800-MEDICARE. It's just those letters spelled out, and ask them. Now, it could be that you just haven't updated your address, so you could check with Social Security actually right now if you haven't received that card to see if they have your updated address, because it is the address on file with Social Security that we're mailing those cards out to.
Is there any way these new cards could be used for fraudulent purposes, even with the new number?
They could, actually. They could, for healthcare fraud, not really personal identity theft anymore, but for healthcare fraud they could. So we're saying protect it like it is a credit card, like you would your old credit card number. And I will tell you there's been fraud going on with the mailing of the cards as well.
Well, that's what I wanted to get to. In what way? How is that being perpetrated?
Well, so the cards are free, number one, and do not pay for getting a new card. Number two, Medicare is not going to call you about this initiative, so just be patient. You'll get that card. People have been calling people up, Medicare beneficiaries up, saying you have to pay to get the new card. I'm going to stop your Medicare benefits if you don't give me your current card number to get the new card. We've also even had insurance brokers calling up and saying, I can get your card quicker if you make an appointment with me. And those folks are probably trying to get you to make an appointment for maybe Medigap insurance. Right now, it would be Medicare open enrollment, probably. No one can get you the card quicker. Medicare is the only agency organization mailing the cards out. All of those calls are fraudulent calls, and you should report those.
Will the cards be arriving in envelopes that are not identifiable as being from Medicare?
They are really basic envelopes, number 10 envelopes. It will have our address on the front side, so don't throw it away. Anything you get from the Centers for Medicare and Medicaid Services, you should not throw away. Yes.
Okay, but if someone has designs on using them fraudulently, they could be identified by the envelope?
It's not going to say your new card is inside. Right. I think it says important information from Medicare. And that is one of the reasons I'll tell you that we're doing this on a rolling basis, and we aren't announcing the mailings ahead of time. They're just coming out, and then we start talking about them to make beneficiaries aware they should check their mailbox.
What do we do with the old cards?
You need to shred them. First, I would blacken out the number, magic marker, and shred them. And I'll tell you some important key messages is start using the card right away so the providers can get it in their systems and they can start billing Medicare correctly. Providers know that this is coming. However, one key message is that providers and you as a Medicare beneficiary can use your old card clear up until December of 2019. So this is, you have a little bit of time before you have to do away with the Social Security use altogether.
Okay. Anything else we need to mention about the cards, the new cards?
I would just say this doesn't replace your Social Security number card that you use. It doesn't replace any other card like your Medigap insurance card. If you get your health insurance through a Medicare Advantage plan, it wouldn't replace that. It's just the original Medicare card.
Okay, let's move along now to open enrollment because we're right in the middle of the open enrollment season. But Julie Brookhart, I'm not sure that everybody fully understands what that means. Yeah.
So Medicare open enrollment is different from initial enrollment into Medicare when you first turn 65. Medicare open enrollment, we stress, is the one time every year that Medicare beneficiaries can make changes to the way they receive their Medicare. So some folks are in original Medicare. Some folks may want to choose a Medicare Advantage plan. Those are plans like the Humanas, Blue Cross and Blue Shield, Coventry, that offer the Medicare Part A and B benefits, but they also offer additional benefits.
It's supplemental benefits to cover the copays and other charges, perhaps.
Well, and we don't really want to say it's supplemental because then we talk about Medigap insurance, and that's what we really identify as supplemental.
And that's where the confusion comes in, I think. People trying to figure out how the two are related or not related.
Okay. So Medicare Advantage, they're plans that contract with Medicare, the Medicare agency, to offer that a different way you can receive your Medicare. So with a Medicare Advantage plan, they have to offer everything that Medicare covers, original Medicare, so that's your doctor, your hospital insurance, your home health, skilled nursing facility, everything that Medicare covers. They can also offer additional benefits. Like Medicare, original Medicare doesn't cover dental, it doesn't cover hearing aids, it doesn't cover vision. So those Medicare Advantage plans market to beneficiaries and say, you might want to look at my plan because we have additional benefits, but you do pay a premium for those. Mm-hmm. So they're a different way to get Medicare and may offer, more benefits. Then if you get Medigap insurance, Medigap only works with original Medicare, and it pays for additional services and also will pay like some of your co-pays on original Medicare. Mm-hmm. If you're in a Medicare Advantage plan, you don't need Medigap insurance because it will probably pick up everything that a Medigap policy would.
What kind of prices are we talking about for Medicare Advantage?
Yeah, so in Missouri, I think the least expensive premium for a Medicare Advantage plan is like $15 a month. But you would also have to still pay that Medicare Part B premium for original Medicare because that plan is going to cover everything from Medicare Part A and B plus additional benefits. So you can get a Medicare Advantage plan for as cheap as about $15 a month. But we always say compare because you don't want to always just pick the least expensive plan. You want to pick the plan that's going to cover the most benefits that you need, the prescriptions you take, the providers that you want in your network.
This requires a lot of homework, doesn't it?
A little bit of homework, and there are resources available here in Missouri and on the Illinois side as well. We have the state health insurance assistance programs. They're the state grant-funded programs. There's one in every state, and they help people with these decisions. They have enrollment events going on. They can help you over the phone. And basically, you can call them and get an appointment. And you would want to bring your prescriptions in with you. Just if you get an appointment, bring the bottles in. They will put those in the Medicare Plan Finder tool and compare the cost and coverages from what you have now, the way you get your Medicare now, to what's available for 2019. And they'll show you what's the best deal for you. And they won't coerce you into signing up for a plan that you don't want because they're unbiased, they're free. These folks are grant funded by the federal government to help beneficiaries.
Are there other ways to get this kind of assistance? Because we're talking about a demographic that may find it difficult to get around and get out and about.
So they can do this help over the phone, too, right from the comfort of your own phone. You can call 1-800-MEDICARE, and they can do this for you over the phone as well. That's 1-800-633-4227.
Okay. We'll post that number on our website, by the way.
That's great.
Yeah.
The other way is, if these folks have caregivers, they have, children, family members who are computer savvy, go to Medicare.gov and use the Plan Finder tool. It's very easy. You put in your name, your address, your Medicare card number, and then it'll just walk you through everything. It'll ask you to put in your prescriptions. There'll be a place for you to note which providers you want to go to, which pharmacies you want to go to. And in the end, it's going to pull up that information and bring that list up to the most cost-effective plans to the more cost-effective plans.
There again, we are talking about a demographic that may not be as computer savvy as the younger generation.
Yes, and that is true. And I would say then you might want to call those 800 numbers to walk you through everything. And again, I can give those to you here, or we can post them online.
Why don't you give them here? We have a little time, and we can go through that while you're here. Okay.
So in Missouri, you want to call the Missouri Claim Program, and that number is 1-800-390-3330. It's pretty easy, 1-800-390-3330. They are taking or will tell you about events going on, or they can help you over the phone. In Illinois, the 800 number is 252-8966. And so it's 1-800-252-8966.
A lot of people are listening to this in their cars and probably not able to write that down. I'll just remind folks, we'll put that on our website as well, so you can use that as a resource.
Yeah, and I was going to tell you, too, they could call 1-800-MEDICARE. That dial.
That's easy.
And then say, give me my state health insurance assistance program number.
We have a caller who has a question for Julie Brookhart. Let's bring in Susan, calling from Maryland Heights. Susan, thanks for calling. You're on the air.
Yeah, this is Susan. I just tuned into the program, and I heard a mention of the cheapest Advantage plans being $15 a month. In fact, mine is zero and has been zero for a few years. Will be zero again next year. I thought that would be important to add.
Yeah. So in some areas, it depends on where you live, because the Medicare Advantage plans cover certain areas. Coverage areas. So there are a few out there, I think, that are zero premium plans, and that is great. And again, I would encourage folks, though, to make sure that don't just pick a plan because it has a very low premium. You're going to want to, because in the long run, it may not be the cheapest plan for you. And so obviously it sounds like this is a good plan for you. You may want to stick with it, but there are some folks that take a lot of prescription drugs, and they would really want to choose a plan that covers the most cost on their prescription drugs that they take, and those change every year. And also, they want to pick a plan where the providers and the pharmacies that they like to go to are covered with being in that plan. Sure. So it's not always about cost, bottom line cost. or monthly premium cost. It really is about bottom line cost overall.
Anything else about this deadline period that we should be talking about?
Yeah,
December 7th is the deadline.
Yes,
deadline.
December 7th is the deadline. This is the one time a year that all Medicare beneficiaries can make a change to the way they receive their Medicare. They can go from original Medicare to a Medicare Advantage plan, a Medicare Advantage plan back to original Medicare, or from one Medicare Advantage plan to another. Yes.
This question may not be a proper one for you, but there's been so much talk about Medicare, and sometimes you think that the system has a bullseye on its back because politicians like to get in on it. How stable is Medicare right now?
Well, every year you hear a different number about when Medicare is going to run out of money. And I think, that changes every year. And we kind of get that threat and we hear about it. But I've been with CMS for a long time. And it seems like the program just always gets better for Medicare beneficiaries. Our numbers are growing because we have the baby boomers that are on Medicare now. And when we talk to people, we hear that, and we know financially that it is the most efficiently ran healthcare in the nation and probably the world. And a lot of insurance companies look at Medicare, and they try to mirror how Medicare is ran and how efficient and cost-effective it is.
Should people anticipate that there may be changes down the line, though, in terms of how much it's going to cost us as taxpayers, and whether they might have to change the age requirements?
I have not heard since I've been with Medicare in 24 years now, that they are changing or looking at changing the age requirements. So don't know about that, and we can't, look into the future and see what's going to happen. But my job is to talk about the good things and the law as it stands today, and what it's all about. So I have not heard. I really actually don't know what the future looks like.
Well, the politicians will certainly have at it at one point or another. Julie Brookhart, thank you for being with us and telling us about the good news. That is, we're getting new cards for those of us on Medicare, and also the open enrollment season has a couple of weeks to go.
Yes, thank you so much. But I will end with this, that we do know that Medicare Advantage plans have gone down in premium price over the last several years. So that's good news, too.
Sure. And you had mentioned early on before we went on the air that you're going to be doing some television tonight to get the word out? Yeah.
So tonight, if you're watching television, you might tune in to KTVI Fox Tune television station from 4 to 7 p.m. tonight. There are going to be some of those volunteers that I talked to you about from the Missouri Claim Program. And we're going to be answering questions about Medicare open enrollment, the new Medicare cards mailing out, and then any question you might have about Medicare. So if you have a longer question, you might want to call in tonight and get that answered.
Okay. Yeah. So you've got a full day ahead of you.
Yes.
Julie Brookhart. She is with the Regional Office for the Centers for Medicare and Medicaid Services in Kansas City.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.